Now, a study by the British Medical Journal says that the pattern of harm in Gaza exceed those in previous modern conflicts. Healthcare workers describe unusually severe traumatic injuries among civilians, including blast injuries and severe burns. So I'm very pleased to can speak to Dr. Victoria Rose. She's been to Gaza 3 times since those Hamas attacks on the 7th of October. Dr. Rose, I really appreciate you making the time to speak to us today. This report from you and your colleagues makes for stark reading. I wonder if we can just start by you telling us what your colleagues in Gaza at the moment are telling you about the situation they're facing there.
Well, a lot of them are telling me that the situation is continuing to deteriorate. They're having huge issues with medical supplies as well as food now. We've seen a spike in the number of viral diarrheal diseases, and obviously with the malnutrition that's still ongoing, it's making it very difficult for my colleagues to treat patients.
Are they getting supplies of medical equipment at this point? I know that the Israelis have said that they have increased the aid, but it's still not near what it was before the war. What is the situation for medical aid getting in right now?
No, they're still very short of medical aid, according to colleagues at the Nasser Medical Complex. They're still struggling for basic supplies.
Now, in the introduction to you, Doctor, we said that you guys have found that the injuries you're seeing in this war are different to anything that's been seen in modern-day conflict. Just expand on that for us and why you think that that is the case.
One of the most significant things that's come out of this survey is the fact that civilians have sustained the sort of injuries that we'd normally only see in soldiers. So there's been comparisons to injury reports from the Afghan war. And compared with that, we are seeing very similar patterns of injuries in the civilians of Gaza. So these are multiple injuries, mainly burns of a very significant depth, combined with multiple trauma injuries to mainly limbs, but also a severe number of gunshot wounds to head have been picked up.
We had that report, Dr. Didn't we, a few months ago now, of a doctor, one of your colleagues, reporting seeing a pattern of injuries. Some days they'd see civilians coming in with injuries to the legs, sometimes be injuries to the arms, sometimes injuries to the abdomen. And the doctor at that time said that that was because it seemed as if these people were being targeted specifically in those body parts as some kind of attempt to maim them in that particular area on that particular day. Is that something that you saw as well, that there seems to be something very odd about the injuries that you're seeing?
Well, those injuries were seen by my colleague Nick Maynard, and they were after the Gaza Humanitarian Foundation shootings. I was in Gaza last in June, so I was present for the very first of those shootings. And certainly we saw a huge number of gunshot wounds to the limbs, which we hadn't seen in the weeks prior to that. But what this study is really showing is that the injuries that we're seeing in civilians is compatible with the use of munitions designed for maximum tissue destruction.
Right. You described deep burns as well. When you're in Gaza, how did patients present to you? Can you give us a sense? I know you've done this with colleagues before, but I think it's worth hearing as well. One of your days working in the trauma unit at the facilities that you worked at.
Well, as a plastic and reconstructive surgeon, I tend to get patients referred or sent down from the emergency department. So most of the people that I was treating had severe multiple body part injuries. We mainly saw bomb and blast injuries. So the types of things that we would see were burns from the heat of the explosion, but also burns caused by anything in the explosion that caught fire. And what we've noticed specifically from this study is the depth of the burns were very significant. So we all reported 3rd and 4th degree burns. We also saw a lot of injuries from the blast itself. So when a bomb goes off, there's an initial pressure wave, that can cause traumatic brain injury, that can perforate lungs, eardrums, but it also displaces someone. So it can pick them up and throw them against something. And we saw a lot of blunt trauma and a lot of deaths from that. And then most of the injuries that I saw were due to shrapnel. So whatever is around you when a bomb goes off is whipped up and ejected at very high velocity, and that then hits you. Interestingly, from this study, what we saw mainly were injuries to the limbs, particularly the lower limbs. And what we know is that shrapnel that hits the head, chest and abdomen often leaves you with an injury that is not compatible with life. So these patients die instantly. And the patients that were being brought into NASA were the ones that would survive their limb injuries. And these would be mainly traumatic amputations of various parts of their limbs.
Dr. Rose, I know you've got a busy schedule ahead, so I won't keep you for too long, but I just want to ask you something slightly outside of your work, if you wouldn't mind, just on the news that we've heard today, that Sir Tony Blair may well go to Gaza to run some kind of interim government there. I mean, what do you make of that? What do healthcare professionals make of that idea that this might be the process if the fighting stops?
I think anything that we can do for a ceasefire right now is essential. We cannot keep going like this. We cannot allow civilians to be maimed and killed in this way at this volume.
Doctor, 10 children have arrived here in the UK from Gaza in the last few months. I wonder if you have any connection with any of those children, if you're able to tell us their condition, and whether or not more children are likely to come here for treatment.
I know the government has initially agreed to accept 50 children, and they have been triaged by various members of the medical profession, some of whom have worked in Gaza. So they are specifically being sent to units that specialise in those injuries. Some of the children that have come over have got congenital injuries or congenital deformities. So things like cleft lips and palates, those sort of things that there is no capability for the Gazan healthcare to provide treatment for at the moment. The bulk of them, however, are trauma victims, and they will be distributed across the country to our major trauma centres.
Right. And Doctor, I'm going to let you go, but you can answer this with one word. Are you going to go back to Gaza to continue the work if you need to?
If they let me in.